My name is Robert Dale. I'm a physician. I'm Canadian trained here in BC. I work as a hospitalist physician doing acute care medicine in the hospital and do cardiac surgery assisting, and I also practice aesthetic medicine. I did my medical school here in British Columbia, and then I did 2 years of surgical residency training here in Vancouver, and then 2 years of family medicine residency training in Victoria. So Botox and filler are very common injectable aesthetic procedures. Botox is a trade name for a type of treatment we call neuromodulator. So the other trade names would be Dysport, Nuceiva, all made by different companies. But the treatment is called a neuromodulator. And what those treatments do is they relax the facial muscles that we have. So if we have facial muscle hypercontraction, it's going to keep putting creases and lines in our skin. So if you think of your skin like a piece of paper, if you keep folding it over a lot of times, you're going to put a crease in that paper. So what the neuromodulators do is they relax the muscles, prevent that contraction, and prevent the development and erase fine lines and wrinkles. So fillers, or dermal fillers, the hyaluronic acid fillers, those are a different treatment to neuromodulators. And so what the modern era fillers are hyaluronic acid. So that's something you may have seen like on expensive skin creams or other dermatological products. So as our faces get older and as we age, a few changes happen. So one, the bony structure of our face changes as bone is remodeled and resorbed. And then the other thing is we have fat pads distributed throughout our face. And so as we get older, those fat pads atrophy, meaning they shrink down in size, or because of gravity and our skin losing collagen and our skin losing elasticity, those fat pads start to descend. And it's that descent that causes a lot of the age-related changes, like folds and jowls and sagginess. So what the fillers do is they bring back the structure and the support and the volume that is lost from the aging process. So very different than neuromodulators, which are a muscle relaxant. Fillers are more of a structural volumizing kind of treatment. So fillers last a lot longer than neuromodulators. I usually tell people on average you can expect about a year. It depends on the treatment area that we're doing, the specific filler product that we're using, because some of the fillers are stiffer or softer, and it depends on the individual person because people will break it down at different rates. Probably the least long treatment is lips, because we like to use a softer filler in the lips because you don't want your lips to be firm, and because you're moving your mouth all day long, it tends to work the product out. So for lips, I tell people you can expect about 9 months. Other areas, however, like chin and jaw, where we're putting in a stiff filler with lots of structure, that can last 18 to 24 months. So on average, I tell people to expect about a year. So for filler, the majority of the effects are instantaneous. You'll see them at the appointment. For both filler and neuromodulators, there is a potential for swelling and bruising like any procedure. So I would say if you had a show coming up, I would probably give it 2 to 4 weeks before the show. For neuromodulators specifically, it takes 2 full weeks for the maximum effect to kick in, and so you would need at a minimum 2 weeks before your show. I suggest 4 weeks with a 2-week follow-up for any touch-ups for neuromodulator treatment.